I want to talk about sex at times. I know that a lot of people are shy out there about talking about it. I'm not, okay? Because here's the thing, neuropathy can really impact upon our sex lives. When people think about neuropathy and that word from a medical standpoint, most medical doctors just think like numbness, tingling, burning, that gnawing pain. And while those are really horrible, they are the typical description of the word neuropathy. However, what I'm going to tell you is there's so many other ways with which neuropathy can be a symptom of just another autoimmune related type issue. Let's talk about also things we don't commonly associate with neuropathy. How many of you have face pain or TMJ? Okay. Or you have neck pain or headache in the back of your neck. How many of you don't even realize you think, oh, it's my neck. It's my TMJ, TMJ, TMJ. And this is me. I'm TMJ and neck pain girl with my mixed connective tissue disorder. Now, mixed connective tissue disorder. Did you hear that? That disorder is commonly associated with, and all autoimmune disease, by the way, is associated with many type of nerve pain. So years of TMJ pain, only to find out it was not my jaw. It was coming from a nerve from the back of my head, and it was part of something called occipital neuralgia.
I'm curious to hear, what did you try? I mean, I'm sure, did you try?
Oh, try 3 years of excruciating jaw pain, me sitting like this every single day, not being able to sleep, waking up at night, even wearing all sorts of appliances, and it was still clenching my jaw and still having a ton of pain. And no matter what I did, didn't work. I had TMJ splints made. I tried craniosacral massage. I tried having intraoral work. I tried having acupuncture. I tried, I mean, you name it, injections. I had injections in my jaw. You named it. Nothing worked.
And
Because you know what?
it was
It wasn't just straight TMJ. It was coming from nerves from the back of my neck. And it wasn't until I discovered that and I treated the problem in my neck and dealt with my autoimmunity that I was like, oh my God, I don't have a TMJ internal jaw issue. It's a nerve issue. The nerve was the target, right? So that can affect TMJ.
I had a lot of spinal issues. I mean, severe spinal issues. I had degenerative disc disease and I had a surgery to have my disc replaced. I also had to end up having fusion and a bone graft because I was in such bad shape. And it did nothing but make the whole process worse.
Yeah.
My neck, it started to begin to make the nerves in my neck hurt, in my face. And I thought it was TMJ, but I wasn't clenching my teeth, so I didn't know it was making my teeth hurt too.
Again, some weird things that are neuropathy. How many of you have bladder issues? When you got to go, you got to go. Right? That's called urge incontinence. Urge incontinence has a lot to do with autoimmune attack against nerve or physical damage to the nerves.
Wow.
So if you have an autoimmune disease and you have urge incontinence, it's a neuropathy. It's a neuralgia. It's a nerve problem.
That's
Okay?
absolutely a symptom that most doctors aren't going to connect for you and let you know these things are related. This is related to your autoimmune neuropathy when you're having bladder control issues.
And this is the point I'm doing this live is I want to actually explain to you how neuropathy has really impacted me and the clients we work with. So you know that you're not alone. And in fact, these are standard, believe it or not, things we see, bread and butter, we see every single day when we talk to people who talk to us about their autoimmune issues. FYI, these are common, okay? I want to talk about sex at times because here's the thing, neuropathy can really impact upon our sex lives. And I know that a lot of people are shy out there about talking about it. I'm not, okay? And I just want to bring that topic up so that people don't feel alone in that. And just even if you don't type it in chat, how many of you have problems with your sexual response where it's weaker than it used to be, harder to get there, or you can't get there at all? How many people out there? Just think to yourself that. Do you know that is a completely solvable problem? And right, and if any of the three of you is brave enough to talk about your own experience with that, please feel free to share. Anyone? I love it, Jessica. Go for it.
Yeah, so speaking as an aspiring birth mother, I think early in my marriage, I was having pelvic pain, not menstrual pain, but just like pelvic pain whenever we would have sex. And I even went to like a pelvic floor therapist. That helped just like a little bit, but you know, the pain persisted. And it was incredibly frustrating because it's like, you think that this is going to be a part of your life that's going to bond you. But if anything, it was just like a strain. And then it's like, how do I get pregnant? How do I conceive without going through the pain? And so it's almost like in my logical mind, I'm like, is this the only way that I'm ever going to conceive? Is to just grit my teeth and and grit my teeth to
There,
pain is not right.
so interesting for me is because you talk about working with pelvic floor specialists. I recently actually started working with a pelvic floor chiropractor. And one of the things I learned, Anne, was that because of the years of plantar fasciitis, chronic low back pain, the way that I was walking, my hips and my ligaments all over my pelvis were really locked up. And they were so scarred, they were rock-like, they cut off the circulation to actually my sexual organs. It was really, I had a very diminished sexual response. It was like hard to never to get there and way weaker than it used to be, if ever. And so a lot of women will just say, or men will say, I don't have a libido. I don't think it's a lack of libido or a lack of attraction to your partner or any less love you feel, but literally you're in pain, or it just takes too much work and it's frustrating. And so for me, what was fascinating was once I, have understood that there's nerves involved, have dealt with my feet, have dealt with, neck, low back pain, other things, working with this pelvic floor chiropractor has really helped and really break up some of that old scar tissue that resulted as a result of chronic years of neuropathy related type pain, putting the hip in weird positions, causing scarring. Can we be scarred in our pelvic area? Can we decrease circulation in that area? And decreased circulation or autoimmune attack against the nerves in that area can cause little to no sexual response. Hell yes. And that's really real. And guess what? It was fixed.
Yay!
It was
Yay,
completely
so Dr. Maggie and her partner too, I'm sure.
It's completely fixable. But I went through many years thinking that that's just the way it was going to be. Jessica talked about pain, but I'm talking about just lack of no response whatsoever. How does that feel? And to think that it was actually tied to the neuropathy, the scarring, the lack of mobility in the pelvic region as a result of my autoimmunity, right? People don't make that link or that connection.
Well, and if you're comfortable sharing, Dr. Maggie, I mean, what did that do to you emotionally when you're trying to connect with a partner and you're not able to have that connection in the way that
I talk about feeling like a super special rare zebra, right? And I felt like a super special rare zebra sexually. It's like, well, why are other women like having normal sexual response and why is it so difficult for me? And that was over a decade of that. And that's something we don't talk about. And I'm sure there's a lot of people in the audience listening right now that resonates with this who's not saying a peep.
like you said, so many people aren't talking about this, but they are probably dealing with it silently and feeling very alone. As we talked about earlier, so many people can feel alone in these kinds of things, but especially this. And once you are bringing it to light and saying, okay, yeah, I dealt with this and we can fix it.
I totally can fix it. You know, when people ask me, it's like, have you seen this? I'm like, yeah, like 1,000 times, maybe 2,000. And they're like, oh, can you fix it? I'm like, what part of hell yeah do you not understand? If anybody's interested in learning more about this, we're going to put a link in chat to start a chat with our team. If you've commented at all and you're interested in learning more, please go check your message with us because it'd be great for you to learn more about us, see more case studies, more trainings. And we'd love to talk to you and get to know your case better to see if we can help and if it's a good fit for us to work together.